And to today's Dollars and Cents, a report by Fidelity Investments shows the staggering costs facing retirees. A 65-year-old who retires this year could spend on average $185,000 on health and medical expenses in retirement. That's up 7.5% from last year. Joining us now to talk about this, local financial advisor Jason Matthews. Thank you so much for joining us. I mean, when I hear that number, I don't know who can afford that. People couldn't afford that while they're working, much less in retirement. Why are these costs so high?
These costs are so high because it includes your co-pays, your prescriptions, your Medicare premiums. Oftentimes people think just because you retire at 65 with your Medicare that your health care cost is going to be free. And this is just the health insurance cost, the health care cost. It does not include your long-term care costs, which can be drastically more expensive as well.
So what are some things that current retirees, first of all, can do to bring these costs down? I mean, I think healthcare is the #1 reason for bankruptcy, right? Medical expenses.
Correct. Absolutely. Yeah. So a couple of things you can do. One is you want to plan, if you are retired, making sure your income balances out with your IRMA or Medicare premiums. If you're close to that limit where your Medicare premiums can drastically go up after $1 additional dollar, you want to make sure you track and plan your expenses and your income throughout the year so you don't get over that limit where you're going to pay more of your Medicare premiums that could put you in a higher, more expenses. The second thing is start using your HSA or your health savings account to pay for those health care costs while you're retired as well. And the third thing, shop around. Find out which place is the best program. Don't be just stuck on one plan. Be adjusted and consider should you do a Senior Advantage plan or your Medicare Part D as well.
Right. I hear a lot of people talking about that, you know, the Medicare B, all these different options. So there are significant changes in costs between plans.
Correct. So there's definitely different changes with between costs during plans, far as who your care provider is, what prescriptions you should take. You should want to get the whole picture. Just don't be stuck every year getting the same exact plan when open enrollment does open up. Also, during this period of time, you should be considering, should you be doing a Roth conversion if you're below that limit? So now that income, the income you have from that won't go against you when you come pay for your Medicare premiums as well. So there's a lot to go into the whole plan.
And things people don't know about, there are things out there like GoodRx. There's ways you can save on prescriptions too. I think maybe people don't realize.
Correct. Yeah, people don't realize that. And that's where it's really important to really dig into it, do your research as well when you go think about it.
What are some things that people can do now if you're 1 year out, 5 years out, 10 years out? What can we all be doing right now to try to prepare for retirement in terms of those costs and try to bring those costs down ahead of time, proactively?
Great question. So one thing is, oftentimes when we think about retirement, we're just thinking about our living expenses and our travel, when we should also bake in the healthcare cost that goes along with it. With that being said, is if possible, contribute to your health savings account. 2, think about before you retire, start doing some Roth conversions. So now that if you take out more income to sustain your lifestyle, it doesn't go against you when it comes to your IRMA or your Medicare premiums as well.
All right. Not everybody has an HSA, right? So you got to usually ask your HR department, right? That's something that's provided through a company.
Correct. Usually provided through your company. Ask if they're eligible for it. See if it even makes sense for you. Because those are, if you do have an HSA plan, you're going to have a high deductible health plan as well. So that's something else you have to consider.
Okay. Jason Matthews, always a lot to consider, but we appreciate your insight on this.
Thank you for having me.
Thanks for coming in. All right, we'll be right back with that opening bell. Markets are headed much higher this morning. We'll be right back.